It's health and wellness time. Welcome to part 4 of the prostate series. Have you or someone you know been affected by prostate cancer? That's a yes for me. That's the main reason I do these healthy tea segments. It helps me gain knowledge regarding the things my family or friends may be going through, and it also allows me to bring awareness to these different diseases or disorders that others may be suffering from. So, my question to you is, how familiar are you with different treatment options for prostate cancer? What are some misconceptions you may have heard about prostate cancer and its treatments? And have you heard of a robotic assisted surgery for prostate cancer? Someone I love dearly just had this surgery. Might I say he's doing phenomenal. Thank you, thank you. And my next question is, what do you think is the most important aspect of prostate cancer awareness? How can we better support those diagnosed with this disease? Let's break down some prostate cancer treatments. Let's start with medications. Hormone therapies. This treatment lowers the levels of the male's hormones, their androgens in the body, which can slow down or stop the growth of the prostate cancer cells. It's usually given through like injections or pills. Then next we have radiation therapy. This treatment uses high energy rays to kill cancer cells. It can be done externally from the outside of the body or internally, placing radioactive materials inside the body near the cancer. Then we have chemotherapy. This involves using powerful drugs to kill cancer cells. It's typically used when the cancer has spread to other parts of the body. We have cryotherapy. This treatment freezes and kills the cancer cells by inserting a needle into the prostate gland and cooling them to very low temperatures. Then we have something called HIFU, which is a high intensity focused ultrasound. This treatment uses ultrasound waves to heat and destroy the cancer cells in the prostate gland. There are surgical options for treating prostate cancer that don't involve robotic assistance, which include open radical prostatectomy. This is a traditional surgical approach where the surgeon makes a single larger incision in the lower abdomen to remove the prostate gland. While it may have a longer recovery time compared to robotic surgery, it's still an effective treatment option. Then we have laparoscopic prostatectomy. In this approach, the surgeon makes several small incisions in the abdomen and uses a laparoscope, which is a thin, flexible tube with a camera, and is specialized for surgical tools to remove the prostate gland. While it's a less invasive than open surgery, it may not offer the same level of precision as someone who may have a robotic surgery. Then we have perineal prostatectomy. This surgery involves making an incision between the scrotum and the anus to assess and remove the prostate gland. It's less common than other surgical approaches, and it may not be suitable for all patients. These non-robotic surgical options may be recommended based on factors such as a surgeon's expertise or the patient's anatomy and the stage of the cancer. Each approach has its own advantages and considerations, so it's important to discuss with your healthcare provider to determine the most appropriate treatment option for you. Now let's talk about surgery, the robotic radical prostatectomy. Now this is an operation that is used to remove the prostate gland in its entirety where the cancer is located. It's done using special tools and a robot to assist the surgeon. The goal is to remove all the cancer while preserving as much of the surrounding tissue as possible. You know, I always have my thinking cap on. And my first thought was, why would anyone opt for a prostate removal? Does that mean that the cancer is serious? So I thought, like, opting for prostate removal, such as through the radical prostatectomy, is often considered when prostate cancer is localized and has not spread beyond the prostate gland. That's what I found out. So they think of curative intent, meaning the goal or the purpose for the medical treatment. Prostate removal is aimed at curing the cancer by completely removing the tumor from the body. For many men with localized prostate cancer, surgery offers a chance for a cure. Now, if they have an aggressive cancer, and meaning like in some cases where the cancer is more aggressive or the patient has a higher risk factor of the cancer spreading, surgery may be recommended to remove the cancer before it has a chance to spread to other parts of the body. Now, long-term survival with the robotic prostatectomy, surgery can offer like the potential for long-term survival, and it can offer a better chance of remaining cancer-free compared to other treatments. That was like, wow, mind-blowing, right? So we talk about personal preferences. Like some individuals may prefer the certainty of having the cancer physically removed from their body rather than undergoing treatments like radiation therapy or hormone therapy. And then I thought, okay, age. Younger men, especially those with a longer life expectancy, may opt for this type of surgery to remove the cancer and to minimize the risk of reoccurrence over their lifetime. While prostate removal is a serious decision, it's not always an indication that the cancer has advanced. It's often recommended for localized cancer where surgery offers the best chance of a cure and long-term survival. Prostate cancer treatments vary based on the stage and the individual health factors. Robotic radical prostatectomy is a common surgical option in the U.S., which I did not know. I had to research. Each year, thousands are completed, with about 80% of the prostatectomies being robotic assists. Now let's talk about pros and cons here. Pros: precision. Robotic surgery offers high precision, minimizing damage to surrounding tissues. 2, faster recovery. Compared to the traditional open surgery, recovery time is often shorter. 3, reduce blood loss. Robotic surgery typically results in less blood loss during the procedure. 4, improved vision. Surgeons have enhanced vision and control with robotic systems, aiding in delicate maneuvers. Now, cons. Costs. Cost number 1, robotic surgery can be more expensive due to equipment and training. 2, there's a learning curve here. Surgeons require specialized training to operate the robotic system effectively. 3, limited haptic feedback. Surgeons might have less tactical feedback compared to the traditional surgeons. 4, potential complications. While rare complications such as infection or injury to nearby structures can occur. Life expectancy. This is huge. Life expectancy post-surgery varies depending on factors such as the stage of the cancer, their overall health, and how early the cancer was actually detected. Generally, the earlier the cancer is detected and treated, the better the prognosis. Now, after surgery, patients may experience temporary side effects such as urinary incontinence or erectile dysfunction. However, many regain their bladder control and their sensual functions over time with proper rehabilitation and support. Regular follow-up appointments are crucial to monitor for any signs of cancer reoccurrence. Well, there you have it. We have covered all things prostate in the last in this 4-part series. And I thank you for joining me, and I look forward to being back here next week with a new Healthy Tea segment. I'm Myss T. If you have not done so, please like, share this video with others. Toodles.